And I just figured, you know what? I'm crazy.
For more than a year, Amy suffered from excruciating headaches.
I was getting to the point after a few months where the migraines were just all day, every day, 24 hours a day. Just kept getting worse and worse. And then I started getting numbness on my right side, and I had stopped having menstrual cycle too, which had stopped, and that was going on for months. It just got worse and worse, and the migraines were worse, and I just kept working, and then I'd go home at night, and as soon as I could, I would just go to bed, close the blinds, put pillows over my head, and just hold my head. And sometimes I'd be screaming, just wishing that I could literally just take my head off my shoulders because the pain was so bad.
Over the next 18 months, Amy was referred to a migraine specialist, an OBGYN, and an eye doctor. But the only diagnosis she received was depression and anxiety.
So I went back to my physician and I said, nothing's working. And I was just crying and crying beside myself. And I put my head down, in tears, and I had looked up for a minute, and she was checking her watch. And I just figured, you know what? I'm crazy. They had convinced me, basically. I was so depressed and anxious that I was just crazy.
Fortunately, Amy saw one more doctor who suspected a pituitary tumor and referred her to Dr. Edward Vates and the URMC Pituitary Program.
Unfortunately, for a lot of patients, it can be hard to come to the right diagnosis. And that's because the pituitary gland controls so many things in the body that when something goes wrong, it can look like a lot of other things.
This is a tiny gland the size of a pea or a little raisin that is right in between your eyes. And in spite of being so small, it's a critical gland. We call it the master of the ship because it really regulates a lot of different hormones with very different functions.
Patients with pituitary tumors have very complicated problems, and managing those problems, making patients feel better, fixing their disease requires a lot of different expertise.
Rochester Neurosurgery Partners created the Pituitary Program to address these complex problems with the region's most advanced and comprehensive care. The program is co-directed by neurosurgeon Dr. Edward Vates and endocrinologist Dr. Laura Calvi. The multidisciplinary team includes specialists in neuro-ophthalmology, neurology, reproductive medicine, genetic counseling, and radiation oncology.
There's actually probably fewer than 10 or 15 centers in the country that offer the kind of team approach that we have here at the University of Rochester Medical Center. Our department is fortunate in that we have a number of outreach clinics that we do throughout upstate New York. So it is quite easy for us to cover all of upstate New York in a way that's really convenient for patients and for their physicians.
The URMC Pituitary Program provides a better experience for patients, and the difference begins with the first visit.
During that time, you get a complete hormonal evaluation as well as a complete neurosurgical evaluation. And you get that all in one trip.
And so the idea is that patients actually get all their questions answered at the same time. And they see us and they know that we're on the same page and that we have really the same plan for them.
Amy appreciated the difference as soon as she met Dr. Vates.
He immediately took me very seriously and wanted to help. And he was just very kind and caring. And it was the first time I felt like somebody really was listening and took me seriously.
Dr. Vates and Dr. Calvi diagnosed Amy's problem as prolactinoma.
A prolactinoma is a benign tumor that is like a little factory for one particular hormone that the pituitary gland produces. That hormone is prolactin, and in women who have given birth and are now nursing, prolactin is important for supporting breast milk production. If you're not nursing, you don't need prolactin, and having extra prolactin in your system can cause a lot of problems, including infertility, headaches, and these were all problems that Amy was facing.
Although prolactinoma can usually be controlled medically, Amy couldn't tolerate the medications and needed surgery to remove the tumor.
We can insert a telescope up through the nose, through the nostril, without making any incision that a patient or anybody else sees. With that telescope, we can see way deep inside the nose. And at the back of the nose, we make a very tiny hole in the bone. Through that hole, I can then see the pituitary gland. I can see where the tumor is. And working with Dr. Miller from the head and neck surgery department, we're able to get the vast majority of tumors out completely in a surgery that takes 2 hours or even less. For the vast majority of patients, they're able to go home within 1 to 2 days after surgery. A lot of patients are back to work within a couple weeks.
Pituitary disorders can be hard to understand, and the prospect of brain surgery is frightening. But Rochester Neurosurgery Partners is committed to educating patients and making them feel at ease.
We try to make sure that every member of the family gets to ask their questions, and we try to make sure that they understand what we are saying to them. That's why our visits are so long, because much of what we do is actually education.
And it was funny because every time I'd go in to see Dr. Vates, he'd say, "Let me start off, do you have any questions?"
Amy's surgery and recovery went smoothly. When asked how she's doing now, she says,
"Awesome, it's great. I haven't had a migraine since."
the surgery also solved Amy's infertility problems.
Almost 4 years ago now, I had my youngest, George, and so he's a miracle. I'm very excited that I have him.
The Pituitary Program also treats pituitary adenoma, Cushing's disease, acromegaly, and a range of other disorders of the pituitary and hypothalamus. For more information about the URMC Pituitary Program and for more stories about our patients, visit our website.